Greetings. Um, by now, you already know or you have already seen the news where a young lady died from snake bite, right? It's in the news because it came to social media. There are a lot of people that die of snake bite in the rural areas that don't get to that don't make the news. You know what I mean? It's quite unfortunate that this happened. And I also looked at the um, pictures of the snake, right? I realized that um, it's a very poisonous snake. It's actually cobra. Cobra is a poisonous snake. I saw the pictures, right? It's a poisonous snake. It's like the one they call a venomous snake. Now, the purpose of this video hmm, is to tell you what to do when a snake bite happens. But before I tell you what to do and what not to do, know that snake bites are best prevented than treated, right? Snake bites are best prevented than treated. So it is important for you to make sure that your environment is clean, free of bushes, and um, if possible, all the crevices, all the holes in the house should be blocked, right? It's best prevented. Because there are some snake bites, some venomous snake. Once they bite you, you will not even be able to get to the hospital. Hmm? You know, there are some poisonous snakes. Some snakes are more poisonous than the other. That's one thing you should know. You'll not even be able to get to the hospital, so it is best prevented, right? And another thing I want to tell you is that no matter how clean you think your environment is, right? It does not mean a snake cannot crawl in. Your environment can be clean. What about your neighbor's environment, like the other house? There could be bushes around it, and that bush in the other neighbor's house, the snake can crawl from it into your house. And another reason you see snakes in the household now is that um, it is dry season, and a lot of farmers are burning bushes. That means snakes will be running away from the bushes and finding comfort in the homes. That's the truth. Now, what do you do when a snake bites you? Or how do you help a snake victim? The first thing to do is not to panic. The more you panic, when a venomous snake bites you, right? The venom want to travel all the way to your heart. That's why when it spreads, want to run, that travel to your heart. Now, that's what it wants to do. But how do you? And it gets worse. It travels faster when you panic. That means your heart beats faster and the venom travels faster. Now, um, what do you now do? You stay calm. It's painful, but you try as much as possible to stay calm. Call for help. Then immobilize the limb. Some of you will now start running up and down. The more you run up and down, the more blood flows to your muscles and the more the venom travel. That's why you see all the posts I've made. They'll say, don't panic, don't run up and down, stay in one place. Stay in one place, right? Call for help. If you have access to water, clean the area with clean water. Then immobilize the limb, right? Don't tie the limb. The more if you tie the limb, that means you may end up losing the limb, right? You may end up with amputation because the venom will end up destroying the muscles around there, right? Don't tie. Immobilize the limb. Just keep the limb in one place where you were beaten, whether in the hand or the leg. Stay in one place. When help come, they'll take you straight to the hospital. Another mistake some of you make is that you will now cut the area and now start sucking the blood around there. You are wasting your time, right? Go straight to the hospital. Um, Now, Another thing you should not do is start trying to maybe say you are applying ice there and the rest. No. Some of you will say it's not a venomous snake. The snake is not poisonous. Don't assume. If a snake bites you, assume it is a poisonous snake. It's a venomous snake until proven otherwise. Don't assume anything. You get what I mean? Don't assume anything. Just assume. Then another thing you must do is that try to see whether you'll be able to identify the kind of snake. Hmm? Try to see whether you'll be able to identify the kind of snake. It will help you in the hospital. Ah, the snake is green. Okay, the doctor will already know it's not poisonous. Or the snake is like this, it's like this. You may not be able, sometimes snake will bite you and you will fail. But if you cannot, no problem. But if you see the snake, keep it in your memory. Okay, the snake was black and the poor spit, there's a way the teeth is and the rest. It will help. Right? That's how you go about it. Go straight to the hospital. When you get to the hospital, they'll give you TT injection, antibiotics, painkillers. Then they will get you anti snake venom. Anti snake venom is a little hard to get, but you can get it in teaching hospitals. I noticed that you cannot really get anti snake venom. It's part of what we are always saying. State governors, no private hospital will stock anti-snake venom, because how many times are you going to use it in a year? It will go out of, it will expire, and they are very expensive, right? But in teaching hospitals, at least I know there are anti-snake venom. At least where I work, there are anti-snake venom. They will see and they will give you. You get. But in all those general hospitals, they no get. I can beat my chest. They no get. Right? They no get. So that's why I want government to come closer to our people. Government must come closer to our people. Your governors, hold them, hold them. I'm holding my ear. Hold them responsible. They must invest in healthcare. Oh. Don't just think that federal government is one that will do everything. No, money goes to them and let them take responsibility. You get what I mean? All those small, small local hospitals, all those hospitals run by local government chairmen and the rest, they don't have. I don't know whether the girl, because I've learned that she went to one of the smaller hospitals. If she had gone to um, national hospital, Abuja, right? They would have had, there will be anti-snake venom there. I can assure you. All those FMCs in Abuja. But all those hospitals are run by AMAC, they're not go get. If they get, na by grace of God. You get what I mean? I learned that is because of the girl did not get anti-snake venom on time. That's what now. But I still don't know. I don't really know the true situation of things. Right? Because with analgesia, antibiotics, anti-TT and the rest, is they'll still be able to do enough for them to be able to get they will be able to prolong time, like delay any onset of death in a patient, right? You get what I mean? A snake, well, cobra can be very venomous. So cobra can be very venomous. We are talking about hospital now. Sometimes some snakes, as they just bite you, you are dead. I will talk more about the different types of snakes, right? So snakes, as they just bite you, you are dead. Before even help come, you are dead. You are gone. You get. So that I will not start blaming anybody. Some snakes are very, especially all those king cobra, they are very venomous. Please. But that does not rule out the fact that we need to do better as a people. We need to start asking our governors certain questions. What are they using the money that is coming to them for? They should invest in healthcare. Federal government, see, healthcare is in the uh, concurrent list. That means both the federal, the state, and the local government are supposed to fund healthcare. It's not only the job of the federal government to do everything, right? I can beat my chest. If you go to any teaching hospital now, they will have anti-snake venom. They have it. But if you go to any general hospital, I can beat my chest that they don't have, or they've not heard of it before. I can assure you. Probably Lagos may do well, oh, places like Bagada General Hospital. But we need to do better. We need to do better as a people. We need to start asking questions. So let the world not leave us behind. We need to start asking questions. Your governor, your commissioner of health, all those people, what are they using the allocation for? Right? What are they using the allocation for? I'm not trying to blame anybody in this situation because when I saw the snake, it's a very poisonous snake. It can kill somebody on the spot. The venom in the there's a man, there's a man that we treated then, right? He had snake beat him. He's a farmer. That's why I told you that snake bite is only making the news now, right? Because the person have happened to, the family were able to post it on social media. You get? There are so many cases of snake bite that don't get to social media. You get what I mean? There are many cases. Now, for this farmer, he was about to harvest plantain. You know, snakes hide around plantain, all those banana plantain leaves, right? All those dry ones. For those of you that have been to farms before, about to harvest, he now, I don't know whether he stepped on the snake. The snake just bit him. And he said he remembered the name of the snake. They were able to kill the snake and they came with the snake to the hospital, right? They came with the snake to the hospital that night, right? And behold, it was the snake they call puff adder. Puff adder. If you see it, it looks like a, butterfly that has not grown wings. Eh? Puff adder, very poisonous. But as at the time it came, the leg was already dead, like already black, right? Red leg was already black because they were trying to spend time looking for how to kill the snake before they came. That is one another mistake you should not make. Hmm? That's another mistake you should not. As soon as the thing happens, start running to the hospital. Now trying to waste time, say let me kill the snake first is not necessary, right? Yes, your people can stay behind while you are trying to kill the snake, right? Your people can stay behind, but on no account, right? Should you be the one waiting, trying to kill the snake. So by the time the man came, the leg was already gone, right? But he survived. We were able to give him the tetanus vaccine, and the man got better. But he was amputated. That limb was amputated. So try and understand these things. Please try and share this message. Share this video so that people will learn. Share this video so that people will learn. It's very important to share it so that people will learn. Share it to your friends, families, and the rest so that people will learn. Snake bite is serious. It has been happening. It has been happening. Ask an average doctor or a nurse, right? They will tell you they see snake bites almost quite often, right? It's just that it's in the news now because it came to social media. Snake bite is common now. It's quite common. Let's do better. Our state governors still have a role to play. Thank you and bye bye.